Hi, my name is Faith, and my presentation today on pathogens is about Mycobacterium tuberculosis. I'll start with the introduction, classification and structure. Mycobacterium tuberculosis is a rod-shaped, non-motile, acid-fast bacterium belonging to the family of Mycobacteriaceae. The cell properties and composition. It has a thick waxy cell wall rich in mycolic acids, which makes it resistant to many disinfectants and responsible for its acid-fast staining properties. Oxygen requirement. This organism thrives in oxygen-rich environments such as the lungs. A key trait is its ability to survive inside macrophages by preventing phagosome lysosome fusion, allowing it to evade immune destruction. Virulence factor, special tools for features that help a bacterium. Important virulence factor include cod factor, which promotes granulomer formation, and sulfites, which interfere with immune cell killing mechanism. Transmission and source. Mycobacterium tuberculosis has a human severe, meaning infected individuals with active pulmonary TB at the primary source of infection. The mode of transmission, tuberculosis spreads through airborne droplets, nuclei, that are released when an infected person coughs, sneezes, speaks, or sings. Inhalation and infections. These microscopic droplets can remain suspended in the air for several hours and are inhaled into the lungs of a person, and that is where infection starts. Risk factors for transmission. Transmission is more likely with prolonged close contact, especially in crowded environments, and also healthcare settings or areas with poor ventilation. Prevention strategies. Prevention measures include respiratory isolation, using N95 masks, especially in healthcare settings, screening high-risk population, and also getting a BCG vaccination in countries with high TB prevalence. The disease pathogenesis. Primary disease, Mycobacterium tuberculosis causes tuberculosis, which is most commonly affects the lungs and also known as pulmonary TB. The initial infection, after inhalation, the bacteria reach the alveoli in the lungs, where they are engulfed by macrophages but are not destroyed. Intercellular survival. Instead of being killed, the bacteria survive inside macrophages and multiply slowly, allowing infection to establish. After that, the immune system responds by surrounding infected cells with immune cells, forming structures called granulomas, which attempt to contain the bacteria. Over time, the center of granula may undergo gaseosis, necrosis, achieves like tissue destruction that is characterized by tuberculosis. latent versus active TB. In many individuals, the infected becomes latent, meaning the bacteria remain inactive within symptoms, but if the immune system weakens, the infection can reactivate and cause active disease. Extrapulmonary spread. In some cases, the bacteria spreads beyond the lungs to organisms such as brain, spine, kidney, or lymph nodes, leading to more severe complications. The symptoms: persistent cough that may last for about 3 weeks, acid-fast bacillus, fever, night sweats, fatigue, weight loss. The bacteria incubation period is 2 to 12 weeks. And how do you diagnose the tuberculosis? There are several ways to do it. There is tuberculosis skin test, PPD, interferon gamma release assay, IGRA, chest x-rays, sputum smear, PCR, treatment. There are several ways you can use the BCG vaccination, new 4-month treatment ligaments. We have the first line therapy, minimum for 6 months, isoniazid, rifampin, ethambutol. And my reference are listed below in case you'd want to check and to have more information. Thank you.